Well, as we learn more about Canada's response, there's troubling news from a U.S. hospital dealing with the infection. A second nurse in Dallas has tested positive for Ebola. Amber Vinson is, for now, in stable condition, but her case is raising serious concerns that measures they're using to contain Ebola are not measuring up. CBC's Lindsay Duncombe has more from Dallas.
Peter, everything we're learning about how this hospital handled Ebola seems to show it wasn't ready. And what happened here put people at risk. Well enough to walk, Amber Vinson boarded a plane en route to Atlanta. She'll be treated in a special isolation unit there. Crews moved in to decontaminate her Dallas apartment this morning. Her neighbors add their voices to the chorus of criticism.
Aren't they supposed to be the ones that are the most protected, the most knowledgeable in how to treat this and not transmit it? It seems like the smartest people are the ones getting the sickest.
It started when Thomas Eric Duncan was sent home from the emergency room without an Ebola test. When he returned days later, he was very sick. Both infected nurses, Amber Vinson and Nina Pham, cared for Duncan on the 3 days his symptoms of diarrhea and vomiting were the worst. In an anonymous statement delivered through a union, nurses at the hospital said their protective gear was flimsy, with skin exposed, that Duncan spent hours in a room with other patients, officials resisting nurses' calls to isolate him. Hazardous waste was allowed to pile up.
Initially, what was said is that these nurses weren't following protocol. What the nurses are saying, there were no protocols.
And another troubling problem. After she was exposed, Amber Vinson took a trip on a plane to Cleveland, flying home to Dallas the day before she got sick. She had a slight temperature. It's against the rules for someone who is self-monitoring to go on a commercial plane, but it's unclear if Vinson knew that. In any case, the CDC is now tracking down 132 people who took the same flight.
Well,
President Barack Obama met with members of his cabinet this afternoon and vowed a more aggressive response.
As soon as somebody is diagnosed with Ebola, we want a rapid response team, a SWAT team, essentially from the CDC, to be on the ground as quickly as possible.
The latest patient had contact with 3 people after she started having symptoms. They've been added to the list of people who are being monitored, and officials are particularly worried about 50 healthcare workers who were in Duncan's room.
Lindsay, how's the Dallas public responding to all this news? Are they afraid?
People seem to understand that you have to be very close to a sick person in order to get infected. But there is frustration here. People are frustrated that while officials were saying they had everything under control, it's becoming clear they didn't. Peter?
Lindsay Duncombe in Dallas tonight. Thanks, Lindsay.